Welcome everyone. So today we have our panelist and former student, Dr. Nikhilesh Srinivasan, and he's a Caribbean grad and he's now on our panel. So we wanted to discuss the challenges and obstacles that the Caribbean graduates face as they approach the match journey, their match plan, and how, in his opinion, they can overcome those challenges and then look for opportunities, maybe even in research, volunteering, to have a successful match. So, welcome, Nikhilesh. Thank you for giving us some time.
Yeah, thank you for having me. Just briefly about myself. So, my name is Nicholas Srinivasan. I'm born and raised here in Denver, Colorado. I went to medical school at St. George's University. I matched back last year in Denver, Colorado at Health One in internal medicine. So, I'm about to finish my first year right now. So, I've worked with many students in the past year, looking at CVs, doing a lot of mock interviews, and also this year I'm doing some mentorship. I have experience, not only my own personal experience from my classmates, and also just from the past year, seeing how Caribbean students are navigating the match process.
Yep, yep. And of course, you have a lot of experience given, like you said, your own journey. So let's start off with the common kind of pitfalls you've seen over the past few years. What goes wrong for the Caribbean applicants?
So one of the big things is that I've seen is that a lot of people talk about that they're not getting letters of recommendation. So the biggest thing with that is people are saying, "Oh, well, it's almost 2 months before match. I don't have any letters of recommendation for my internal medicine." So the big thing with that is to avoid that kind of stuff is what I tell students is that when you're on those rotations, ask right away for the letter of recommendation. Don't wait 3 months, don't wait 4 months, just because the preceptor will not know who you are in three to
Mhm.
4 months. But the biggest thing when you give your right, I think that when you want to ask for a letter of recommendation, the best time to do that is right after a rotation ends. And why I say that is because the preceptor, it's right in their mind who you are as a student. They just observed who you were, how you did throughout the rotation. And so what you should do is that you should create a CV beforehand with with your picture there, give it to the preceptor right away, let them know that you're very interested in this specialty. And the biggest thing that in the coming months after rotation is that I see that a lot of students don't follow up. And
Okay.
so it becomes 3, 4 months. And, the preceptor said, yes, I'll write a recommendation for you. But 3, 4 months goes away and they have a lot more students. They forget who you were originally. And so the biggest thing that I would say is that you have to follow up almost monthly with them just to make sure that they have the letter written. They don't forget who you are. That's the biggest two things for a preceptor to write a recommendation is that you want them to just remember who you are. That's why I say put a picture on when you give a CV as well. That way, CVs, many people, many of the Caribbean students, we all have very similar CVs. And so a picture goes a long way. And so these are just some ways to get letters of rec. Um,
Okay.
Another pitfall that I've seen is that during interview season, a lot of applicants they think that programs will just send them interviews and they don't reach out to programs themselves. And so, even in my own personal experience, I actually wrote a lot of letters of interest to programs. So, when I wrote these letters of interest, I made them very specific to the program itself. So, I made sure that I told them if I had family in the area, I told them that I had family in the area. Or if I had some kind of interest in that area, I let them know right away. And I also highlighted different parts of their programs. I went to their websites, looked at different parts that fit my own CV and kind of told them, oh, for example, there was a program in Pennsylvania. I saw that they're really big into hospice care. So when I was in medical school, I volunteered at a hospice center. And so I highlighted in my letter of interest about the experiences I had at that hospice care. And I wrote that, trying to reflect that their program and how they have 1 month of palliative care kind of fits my goals of what I've done in the past. And so that way it kind of showed some interest. And during my interview at that program, that was actually brought up, that my letter of interest really caught their attention, because they said that because of my past experiences, that I would do pretty well in their program, with especially with the focus on palliative care that they had.
Okay.
Uh,
So we
yeah.
said LORs, and then we program reach out. I
Mhm.
think the other thing was the gaps, or what else are the pitfalls?
Yeah, so another problem that many Caribbean students run into is their rotation schedule.
I
And
see.
so, what happens with these rotation schedules is that sometimes they have back to back rotations, and then they'll have 2 months gap between their family med rotation until their internal med rotation, for example. And so, many students ask, what do I say that happens during those 2 months? Do I just tell them that I was studying for a step exam, or that this Caribbean school didn't have it scheduled? What I tell students is that you should just always try to fill in gaps best as possible. Obviously, studying for step exams is important, but I think that what would be more relevant is if you say that you've been working on research, or you have a volunteer activity, or that you're doing something actively in the medical field. It doesn't have to necessarily be something directly related to medical school. It could be also just some volunteering experience, or some experience you get through working at a homeless shelter. Just some experience to where it looks like these when you are in an interview and they ask you about these gaps and what you did in that spare time, you have something to fill in. And I think that's another key with the Caribbean students. And then another pitfall I've been seeing with Caribbean students is that many of them say that they switch Caribbean schools. Many start at one
Yes.
Caribbean school, go to another Caribbean school. So that's also very easy to explain during an interview process, especially if there was, a family reason or financial reason. But a lot of Caribbean students, think that is a major disadvantage to them, and they try to hide it as much as possible, that they started at one school, switched to another school. And so, what I tell the Caribbean students who are in that situation is that to be honest, especially during the interview process, be honest about what happened. Um, Especially program directors, many of them at the end of the day are understanding if there's any financial issues, any family issues that came up, even academic reasons. If for some reason you did not do well at one of the Caribbean schools, and then you switched over and then you started doing very well at the other Caribbean school, this is something that could work in your benefit. It just shows that you're adaptable to different, you went from one Caribbean school to another, and it shows resilience as well. And that's something that programs really look for, is somebody who can, go through adversity, but at the end of the day, they still have a good outcome, and they still are, uh, focused on their ultimate goal of becoming a doctor.
Okay. So the other question we often get asked, and this is, I think, going beyond Caribbean, is applying to multiple specialties. So IM, FM, and neuro and psych and path. What are your thoughts? Have you seen this? When is this applicable or okay to do? And is that a common kind of pitfall you have seen, that applying to multiple specialties, not focusing on maybe one or two?
Mhm. So this can be both advantage and disadvantage. In my opinion, though, I think this is a disadvantage if you apply to more than two specialties. Because at the end of the day, what you're doing when you're focusing on one specialty is that you're trying to get as many letters of recommendation from that specific specialty. You're trying to gear your CV towards that specific specialty. And so, in that regard, if you're all over the place, if you're applying to 4 or 5 different specialties, your CV is not very specific. Um, your personal statement, you're going to have to write multiple personal statements. And this can also, I've seen backfire on many students during interview season, because um, they've applied to 4 different specialties. They can't
Mhm.
keep a track of which specialty they're interviewing for. And so sometimes during the interview, they might say something from another specialty during a interview for, let's say, internal medicine. They say something about neurology. So I would say that if you always should apply to a single specialty of your interest, but always have a backup plan just in case. So I'd recommend two specialties if you're going to go in that direction, just because it's easier to go for your primary plan, get everything geared up towards that. But also, it's also very advantageous, especially for as a Caribbean graduate. At the end of the day, you want to get a job. And so you always want to have a backup plan. If internal medicine or one specialty, family medicine, neurology is your one specialty of interest and you don't want to do anything else, I say go for it all. Obviously, with that, I would say another pitfall I've seen with Caribbean students is that they feel that just because they went to the Caribbean, they are geographically restricted to certain parts of the United States. Um,
Yes, let's talk about that, especially,
mhm.
New York. A lot of students tell us, are they eligible, not eligible for New York? How does that work?
So it depends from Caribbean school to Caribbean school.
I see.
So I know for a fact that there's certain Caribbean schools that are accredited in California, New York, Florida, Texas. So those are typically the states that require additional, certification from the Caribbean school itself, and that's something as a Caribbean graduate, that's on your school. That's you can't control that aspect of it. But
Mm.
for the most part, most Caribbean schools are accredited in California, New York, and all these major states. And so the big thing I would say is a lot of students feel, oh, I haven't done enough rotations in, so let's say, New York and New Jersey. But in reality, that place, New York, New Jersey, is where a lot of the programs that are IMG friendly are located. And so at the end of the day, just because you haven't done a rotation there or you feel that nobody in your school is matched in that area, it's not it played to your disadvantage if you did not apply to those regions, just because those places have the highest volume for IMGs.
So you are saying that they should focus on these states for rotations: New York, New Jersey, Michigan, Illinois, those kind
Hmm.
of East
Yes.
Coast, Midwest.
So
Okay.
definitely, I think that the IMG friendly states are definitely places where they should be doing their rotations, especially their core rotations. Another big thing, especially as even in the US schools, is something called sub-internship. And
Hmm.
so these are just pretty much in the as in the real financial world or something. This is pretty much an internship they do in college, but we do this in medical school. And so with those are very important because many people give interviews off how you do on a sub internship. Compared third year of rotations, those are usually core rotations. And so for that, most Caribbean schools just randomly assign you to a region or a couple hospitals. And so for those, what I recommend is just build as much connection as possible, because in those, even the smallest connection, whether it be a resident, an attending, a fellow, everybody has trained somewhere. They know other people who have trained. It doesn't have to necessarily be in that area. It could be anywhere in the States. And so, what they should focus on their third year, especially, is getting as good grades as possible, especially on the shelf exams. This is something that is very key to the Caribbean process. Is that one thing that is standardized between the Caribbean schools and I would say even just the USMD schools, the USDO schools, is these shelf exams.
Mm.
This is a test given by the MBNMEs. And so you really want to focus and do well on these tests. The LORs and what you get from these are also very important. But I think that just having, at the end of the day, most programs are looking for a way to differentiate people. And one way they do that is by looking at your grades and how you did on these shelf exams. Meanwhile, for fourth year, for these sub internships, the biggest thing is that you want to display everything possible, your knowledge, your work ethic, and express to during these sub internships, especially the biggest thing I think that I've seen that works for most Caribbean graduates is that they go out of their way to meet people not only on their own specific team that they are assigned to, Even if you do not work with the PD directly, the assistant program director, what I recommend is that you go to their office at some point during your fourth year of medical school. If you're doing a sub internship at a program, reach out to them, email them, talk to the program coordinator, try to set up a meeting with them just so they have a face, and they know who you are. If not, then you are just another number who's applying. And they have so many people that do sub internships, especially as Caribbean people. We're kind of scattered when we're trying to look for these sub internships. So the biggest thing is to just differentiate yourself from the rest of the pack. And the biggest way to do that is just to, build as much connection as possible.
So now let's switch gears and move on to maybe opportunities in research, volunteering. How can Caribbean students get those opportunities? What are the problems you have seen as they
Yeah.
apply?
So one of the biggest things is everybody from the Caribbean says, "Oh, I didn't, my first 2 years of medical school, it was impossible to get research." And that is fine. Most people from the Caribbean do not actually do research their first 2 years just because the sheer volume of the students in the schools, and the first 2 years you're very studying for step one. Not too many people are keen on taking first and second year medical students on for projects, especially if you're on an island for the first 2 years doing your first two basic science years. It's very hard to get research. So what I recommend is third year of medical school. It might be too late for some people, but third year is when you should be starting to look for research. And the best way to do that is just ask the people you work with. Residents are always looking for, they're either on projects. There's always some residents on some projects. There's faculty that are doing projects actively. It's a lot easier to become part of a project than start a project from scratch.
Right.
Obviously, starting a project from scratch is great as well. Another thing I recommend is if you see an interesting case, write it up. Um, Attendings and residents are more than happy to help you write those cases, and publish those cases. And if you just, there's so many different places that you can submit these posters to. Many hospitals itself have their own symposiums for residents and medical students. And so you just have to ask, and ask where we can submit these posters. And there's always some conference or somewhere that you can get these published and you can present. And so I think the biggest thing is just reaching out to the faculty, whoever you're directly working with. That's the best way you'll get research, not through these online forums, trying to start a research project by yourself and trying to get faculty to get on with that research. That's a little tougher. That's something more resident and fellowship level. Usually as a medical student, most programs, when they're interviewing candidates, they're not looking for somebody to how much bench work you've done. They're just looking to see if you've done clinically relevant research. And case reports and QI projects, these are great and simple, easy ways that Caribbean graduates can get acquainted to research.
Okay. Well, that was great. I think we covered a lot of ground in terms of the challenges and how they can overcome. Anything else that we missed in our discussion?
No, I mean, these are just some of the very superficial stuff for Caribbean graduates, in terms of their pitfalls and what I've seen in the past. Um, Obviously, there's many factors that go in with a Caribbean, the match process. Each Caribbean school is very different from each other. I know some provide a lot more guidance. Some of them are a little bit more on the student aspect. But at the end of the day, I think as a Caribbean graduate, the biggest thing that you have to do is that you have to be your own self advocate. You
Mhm.
have to advocate for yourself to get LORs. You have to make sure that your school is submitting the MSPE, anything that they need to do right away, and that you are telling your preceptors and stuff, you're communicating with them what your interests are, um, and telling them pretty much what direction you would like to go. A lot of times people do not think that certain preceptors or PD really wants to talk to them just because they're a medical student. They're so low in the ranking, but that's not a true thing at all. People are always willing to help. You just have to seek help in order to get it.
Okay. Well, thank you very much, Nikhilesh. This was very, very useful. I appreciate your time, and hopefully, our audience, especially the Caribbean grads, find it useful.
Thank you so much for having me.
Thank you.